Sheridan Medical Group approached the University at Buffalo probably a little bit over 10 years now. And Dr. Carlson, the medical director there, had asked a faculty member to oversee students in primary care. He had been familiar with Fred Bennis's work, pharmacist that used to be faculty with University of Buffalo before he passed on, and was really well known for his integration and really just his amazing knowledge base and social ability to work within the medical practice, as he really was known as a guy that became a key part of medical care and was really one of the best teachers that I had throughout University at Buffalo, my time at the School of Pharmacy. And I was excited to take on this challenge almost 10 years ago. And I would say pretty proudly now that I think this is one of the best rotations that we have available through the School of Pharmacy. And that's largely because of the amazing people at Sheridan Medical Group. And each rotation, and I think even at the end of each year, I get to look back and reflect back on comments. And what I would tell you is, why do you want to spend 12 weeks with somebody throughout your APPE rotations? You want to spend 12 weeks with somebody because you feel that you're going to grow as a professional, and you're going to grow to become a bit more independent, and you're going to feel confident as you step into the next phase of your career, whether you think that's going to end up being community practice, clinical practice, or especially this rotation is really key, I think, for people that want to go into postdoc residencies. Obviously, this is a little bit more ambulatory care focused as a primary care medical group, but I think the principles and the teachings that we do each week and throughout the day-to-day actions of the clinic really prepare students for becoming independent, or is sort of a mini residency type of experience for 6 weeks and even extending into 12 weeks. I'll give a little bit of an overview of the practice here. Sheridan Medical Group is located in Kenmore, New York. That's 1491 Sheridan Drive. Pretty easily accessible. Parking is pretty easy. Those kind of things all on site at the clinic. And their vision is to be a model primary care medical group that provides individualized care for every patient. And they live this mission of being innovative, being comprehensive, being interdisciplinary. Again, the students have been involved for well over 10 years now, and if you talk to any student that's completed the rotation, you will find that you are a key part of the medical practice. It's not a tangential or superfluous thing that pharmacy is involved. You are integrated into every day in decision making on hundreds and hundreds of patients before the end of your time. And again, as my bar as a preceptor, that's what I intend to do, is to give you some comfort that when you leave our time together, that you feel like more of an independent provider. The providers that I'll just jump to really quick here: Dr. Carlson, you can see a visual of him there and his bio here. Really intensely integrated with students, a lot of meeting time, a lot of individual project work, integration with specific patient cases. And Dr. Jane, who much along the same, also the owner/medical group coordinator. You have, he's involved, they basically break students up into each team, one with Dr. Carlson, one with Dr. Jane, and they may have some additional people at the practice day to day that are a bit more sort of in a specialty type of role, but predominantly the students are integrated with Dr. Carlson and Dr. Jane. One side aspect is we do a lot of research with the University of Buffalo's, the pharmacy school, obviously, and big into focused on geriatric management and ideally de-prescribing and seeing if we can get people off of unnecessary medications. So you'll notice that to be a bit of a theme. So day to day at the practice, I'm going to give you a little bit of an overview. I mentioned the site. Our primary site contact is Jennifer Carlson. There'll be several other people that you'll meet. Sort of unique to the medical group is that they have a systems engineer that runs their operations, a gentleman named Prabhakar. You may meet him several times throughout your time, but I will always be your preceptor of record. The physicians will precept you on site or virtually if the model is going to be any kind of hybrid by that time. We have run both virtual and on site. I prefer on site, but both have seemed to work really well based on my perception and just student feedback. And we try to build a practice culture that's extremely open. I will always say to every student at the beginning of each rotation, it's not my job to be negative or derogatory or really be significantly evaluating what your deficiencies are in therapeutics. our job together, my job, is to help you self-identify those issues so that you feel as though you can go about learning these and progress as a student. So you'll find the culture to be very flat as opposed to a hierarchy. We try to work on a similar plane as one another, as opposed to a more sort of paternalistic type view. We try to work sort of more on an even plane with people, which basically means be comfortable when you're practicing, ask questions, your opinion and your questions are going to be respected and not in any way derogatory. The goals of the rotation are really pretty simple. We're going to provide an environment for students to observe physicians, actively participate in the actual day-to-day management. You'll manage your own cues. You'll have patient visits that you'll be responsible for. You'll be responsible for in-between visits. And certainly you're going to have a very strong understanding of diabetes, hyperlipidemia, and hypertension, those being, and certainly obesity being my specialty area. Those are going to be areas that you're going to be coming out much more confident therapeutically. But again, my job, not just build the therapeutics that I'm really well acclimated with, it's how do you step in and start learning therapeutics in a way that you feel confident for the rest of your career. You'll design and implement the drug therapy regimens. You'll be handed off follow-up. You'll be contacting patients, interviewing them, suggesting change. And we'd like to develop disease state and drug information skills for a fast-paced primary care environment. I often start off the rotation by telling people you need to get faster, but you need a plan and you need an approach on how to do that. And we are going to beat that in repeatedly every week until you feel like it's automatic. And instead of taking 20 or 30 minutes to review a chart, you're going to feel like you can do it in 2 or 3 and have a plan about how you're going to go about tactically interviewing a patient to get to the point of assessing and planning and following up and implementing all as one continuous process. And that takes time. That is the absolute hardest thing, I think, for making the jump from a student to a professional, is how to approach it and how to get it all integrated into one continuous process that can happen, and you can have a good social dialogue with a patient, and all of that can happen in a 10 to 15-minute window. So how do we really do that? We do that through this repetition, and we learn this in the second year of pharmacy school in our PHM 615 course, but it becomes real in clinic when you're doing it day to day. I am very intense on clinical process, meaning chief complaint, stepping into the HPI, the past medical history, the family and social, and on through the process. I often do a challenge each week with the students in terms of case presentations where they will not present us the medications. And if we do a good enough job with the process, we understand which medications are on. We can predict them to a high degree of certainty, or if we're wrong, we've already built our assessment and plan because we've worked that through intuitively. So these are all the aspects of things that I find exciting about the rotation, things that I have found personal value in, and I know I've helped a lot of students transition into their postdoc careers of residency or other clinical type interests. For those people that are thinking about the 12-week program, we do the 6 weeks, we extend the 6 weeks in terms of clinic and therapeutics, but we layer on some more leadership aspects, some practice design, practice protocol implementation, whether that would be a formulary review, whether that would be a drug conversion program, something related to either clinical practice or economics. Those are all different projects that the physicians or I will assign throughout the course of the rotation. And we're going to try to pretty much expose you to as many disease states as we can, again, to just make sure that you feel like you are residency prepared, whether you go that pathway or not. You will be feeling as though a top level candidate, especially from an experience and a clinical standpoint. And really, that's the end of the overview that I would give here. I would just end with saying that I tried to be very open and clear with grading. You're going to have a primary project that, of course, is going to be evaluated. You'll have to maintain your time and aspects with the clinic, but our main focus is getting you exposed to as much of patient care and the actual care process as possible. So I tend to keep things pretty light outside of the day-to-day requirements that you have, which are significant. I am not going to sugarcoat a rotation at all. I talk to our students and we tend to feel that they are getting ready and the day started by 7:30, and they may work well into the 5 or 6 o'clock hour because frankly, that's when people need care. And that's when people become available. So there's flexibility day to day. If you need to run out and do something, that's all, those types of things are well received, and the communication is very good with the practice. We've been doing this for a very long time, obviously. So, but I expect a very high level of personal vigilance and effort, and we reward that basically with a high level of oversight from physicians and from myself, and then obviously to help you grow into the professional that we hope and want you to be. So I thank you for your time. Anybody that wishes to contact me, I'm sure Chris Jordan will put our contact information up, but I'll end with it right here. If anybody wants to reach me, you can always reach me at that email, svmonty@buffalo.edu. Thank you.